Hello dear patients. Today we are going to review the case of dark spots in groin, particularly on the upper part, on internal part of the thigh, and lichenification, thickening of the skin and itch in the anal fold. A young man came to see us. Spots started to appear. You can see them on the picture. They are located in the area of internal side of the thigh. The spots are of dark color. They itched a little. There was also an itch in the area of anal fold. You can see it on the picture. You can see thickening of the skin in anal fold above the anus. Also, you can see the appearance of such white, densely adjacent deposit. What needs to be done here? First of all, skin scraping for microscopy has to be done. This is a method when skin pells are looked at under a microscope in preparation with potassium hydroxide, and characteristic fungal spores are observed. Such scraping was also taken from the area of anal fold. Culture test for bacteria and fungi was taken from this area, as well as PCR for 12 fungi of Candida, as such picture can also be induced by candidosis. As a result of that, on both areas of the skin, characteristic fungal spores were found, as well as short, resembling cigarette butts, handlings of Malassezia fungus. This is Tinea versicolor, that can affect not only skin of upper part of thorax and back, shoulders and neck, as well as inguinal folds. Not a lot of people pay attention at this fact. There are not many of such patients in comparison with the first group. In this case, in case of dubious diagnosis, illumination in Wood's lamp can help us with characteristic glow. You can see a separate video on our channel about what is Wood's lamp and what is a characteristic glow during Tinea versicolor. The most frequently used wavelength is 365 nanometers. It is looked at in the darkness, and yellow-orange glow indicates Tinea versicolor. In some cases, culture test for fungi is used, with determining of species membership of fungi to Malassezia family. Malassezia furfur is the one that most commonly induces such clinical picture. It's important to note that not in all patients intergluteal area is affected, apart from inguinal folds and upper part of thigh. It's no doubt that often this is facilitated by maceration, sweatiness, etc. What needs to be done here? Antifungal medications have to be prescribed. Antifungal medications are prescribed externally, in the form of ointments. The examples are ketoconazole, clotrimazole, as well as internally. The most commonly prescribed internal medications are ketoconazole and fluconazole in corresponding dosages. On our channel you can see a separate video about what is a treatment of Tinea versicolor and how it is done. In some cases, in chronic cases, we also prescribe ultraviolet radiation and intravenous administration of fluconazole, in particular diflucan medication. In these quite resistant cases, this is a lesion of inguinal and intergluteal folds. The relapses are often seen on the areas that have increased sweatiness, and multiplication of such fungi takes place there. So inguinal area is affected not only by sexually transmitted infections, but by different fungi, allergies, etc. In some cases, these skin infections are not prone to a good treatment, because, as I said, inguinal area skin often sweats. Often the patients do not wash it very well. This all leading to persistence of such fungal infections. If it is necessary to diagnose and treat different lesions in the area of sexual organs and anus, you can consult dermatovenerologists of our paid medical center or dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.